Hi, so I'm Julianna Williams, and I did my systematic paper on acupuncture, and I also did my lab report on acupuncture, so I kind of have a little bit more background information to add into. So I just took some notes on what I wanted to talk about from my paper, and really what I really found most interesting, well, two main things, is that this acupuncture practice is for all ages. So some of my topics I talked about how to deal with infants, which I thought was very fascinating. I didn't think that, most people would want to put little needles in babies, but they do, because it can be seen as very helpful. It can work all middle-aged adolescents and adults, because these people, whoever has these conditions, can happen in all ages. Also, it can be more effective depending on where you place the needle in the body, how many needles you place in the body, and how long you leave them in. So a really good example that I was writing about in my paper is for colic babies. So colic is just where they're really fussy, and it's actually a thing. So it's more than a few hours a day, for every day for a long period of time, and then they're known with having colic. And obviously when your baby is crying all the time, it's very exhausting as a parent, because there's not much you can do, and you just feel like you failed maybe, and it's very exhausting too. You're not getting as much sleep or something. So with colic, they took a group of 147 babies, and they really, in some of the group, they put an acupuncture needle right here in between on the hand, and they left it in for 2 to 5 seconds. Just that's it. And it did seem to be very beneficial, even just that alone. And then they also, the other group, they placed more needles in their hands and then their legs for 30 seconds. So it was a little bit more needles and a longer period of time. And that seemed to work as well too. And even within the first few weeks of doing that, or days, whatever, the parents saw a decrease in the crying of their children. And it was known to be long lasting. So eventually, the babies grow out of colic anyway. This can either speed up the process or just stop it and lower it at all, which is very helpful, and it's very safe practice. They found it's very safe. It's a little needle. It's not going to cause much bleeding, or it's not a medication that is going to affect their intestines and all that. So it's very safe and effective for babies with colic. Sticking on the baby route, I wrote about how you can use this for cancers in infants, and it could be for adults and elderly too, but specifically in babies with fibromyalgia or fibrosarcoma. Their symptoms from chemotherapy, like vomiting and just fatigue, it seemed to help that. So then having those symptoms relieved helped them just feel better overall, because obviously they already have cancer, which is very exhausting because you're always in the hospital, and then getting chemo is really what's making you feel sick, even though hopefully it should be helping. And having the acupuncture for those symptoms really just helped them feel overall better, because depending on where they were placed, so less nausea and vomiting, they're gonna not lose as much bodily fluids, and not be as small and malnourished. So it just kind of is a domino effect. If you fix this, and it's going to fix that, and it can be very beneficial for those patients. Headaches. So obviously headaches are very common. It can be just a simple headache. You need to lay down, rest, take some ibuprofen or whatever, and you're fine. Chronic headaches and cluster headaches are very common. If you can just put, there's points here for acupuncture, and just, stimulating your body and your brain with those needles is sending things through your body, which are helping your physiological processes heal. So that's why the different points are so important to understand. And even I get migraines, and maybe, acupuncture could help me for those, instead of maybe my tense shoulders or my pain in my back. Maybe acupuncture would be good for that too. I never really got to understand that until after my sessions. And then obviously postpartum I wrote about, and it wasn't very successful, because a lot of people, or a lot of women, because they're the ones in postpartum, they can get depression after having their child, and so they tried to do studies on acupuncture for that, and like really it did lower some of their age something level, so it's like a level of depression, and it did lower that, but not, it raised other, I wouldn't say raised, it kept their other depression levels similar, and it didn't really, it does treat anxiety though, so it didn't really help the postpartum depression, which I thought was very interesting, because I do know that acupuncture helps with anxiety, which I know a lot of people struggle with, close people and all that. And anxiety, again, it's, your hypothalamus can be stimulated, or like releases these stressors, these chemicals that cause these stressors. So, whatever you're stressed about or worried about, and like making you have anxiety, if you do acupuncture, it will relax those things in your brain, like the hypothalamus. It will relax that, calm it down, so it lowers your stress level and worries, or it lowers what you're worried about. So I think because, a lot of people just, go to therapy or go on medication, those may work, but I think acupuncture as an alternative, or even you can add on acupuncture to that. So you could maybe be taking medication for your anxiety and mental problem, but you could even add on acupuncture to that and really enhance your outcome of feeling better overall, and less stressed and less worried and less anxious overall. And lastly, I talked about menopause. Every woman, when they get into their older age, late 40s, 50s, maybe even early 60s, will go through menopause. And, it's kind of, you can't really get around that. Most women will, unless there's something like, I don't even know. I've never heard of anybody. So menopause, it's, you have your symptoms of the most ones everyone hears about is like hot flashes and night sweats and just hot. And menopause, or acupuncture, was found to be very, very beneficial for these symptoms. So they took, a group of ladies, and like they obviously like filled out a questionnaire, like, oh, what are your symptoms now? Like, what do you want to happen? Like, how, because there are so many symptoms you could get with menopause. So, really making sure that the researchers know which ones each lady has, because, some might be more severe than others and stuff. So they did a 15-minute session, which is short. So it doesn't, acupuncture is very interesting because it's very quick. You would think you might need to leave the needles in there for a while, but for these ladies that were going through menopause, they had, for each week, they would just have a 15-minute acupuncture session. And all of these people that I talked about that did the acupuncture, they were all trained personnel. They even said that in their articles, that they have their license and stuff. So yeah, these women, they would just go in for 15 minutes, and they would feel, in the first 3 weeks, they felt better about having hot flashes. Like, they did have hot flashes, they were reduced. They might have some still, but it was significantly reduced, which I found very interesting, because those are really the worst symptoms and stuff, and that's what you talk about a lot. And then within 6 weeks, they even decreased night sweats, which is great, because then, that's kind of another domino effect. If you decrease your night sweats, you're going to get better sleep at night. A lot of people sleep better when it's cold, so if you're having night sweats, you're not going to sleep as well. So it's really nice that if it decreases that, then you're going to get better sleep overall and just feel better, good night's rest. So that is really what I found very interesting, and what I wrote a lot about in my systematic paper. Thank you.